This is the data which I would like to share with you. The kingdom is really, the diabetes is really costing the kingdom almost 100 billion Saudi riyal. Out of this, 12 billion is direct cost and another 88 billion non-direct. I will not touch the non-direct because it's a very complicated issue, but I'll show you some of the data from the direct cost. You can see that this is the overall cost, but big chunk of it is really coming from the hospital care. I think if we work hard on education and prevention, this much of spent is going to decrease slowly, and we are going to be in a better shape. Now, look at the drug supply, about 1 billion, another 1 billion, 300 million for foot care, another dental care is costing almost 1 billion, $500 million for dialysis, and so on and so forth. This is when you spread them into type 1 diabetes versus type 2 diabetes, which is the childhood diabetes and adulthood diabetes. You can see that the majority is type 2 diabetes. And I'll tell you why. Because the complication is high among them, and they are high in number. We do not have a big problem with type 1 diabetes. It is increasing with time, but I can tell you, number-wise, the more than 80% of our diabetic population are type 2 diabetes. Now, I would share with my colleagues who have just spoke about the change from the time you've been diagnosed with impaired glucose tolerant to the time when you develop ischemic heart disease, cost-wise. And this is the study which was published in Diabetes Care, which is really very sensitive and beautifully designed. Look at this. From the time the patient has been found to be pre-diabetic to the time he will be diabetic with the complications, you can multiply his cost by almost 3 times. You can prevent all this by secondary prevention and primary prevention. Where we should put our money? I think we have 4 levels. We have the community level, the patient's level, the health system level, and the doctor's level. Now, I want to tell you that in the community, we are going to work on the primary prevention, community education, risk factor reduction, and different sectors' involvement. At the patient level, we have to screen them because you have to catch them early and you have to manage them early. And here you have to catch the persons who are at risk, medical checkup, and periodical examination. Now, for the health system, we are going to work mainly on the secondary